Good morning, everyone. Thank you for joining Indiana SHIP for What to Know Wednesday. In a few minutes, we're going to hear some great information from some friends down in Southwest Indiana. And I'm joined, as usual, by my co-hostesses, Megan in Northern Indiana, Melanie in Southern Indiana, and I'm Susan here in Central Indiana. Today, we are going to talk about what is an enrollment center. That can mean a whole lot of things to different people. But in the Indiana SHIP world, an enrollment center is an agency or a company that Indiana SHIP partners with, where folks can go to get help with applications for some really important savings programs. So this is for people with Medicare of all ages, young Medicare people, older Medicare people, and everybody in between. There are programs that can help you pay some or all of what Medicare doesn't. So enrollment centers are local places where folks can go in their neighborhoods or in their towns to get help with those applications. And today we're joined by two people who are in Southwest Indiana, Wendy Bailey and Trevor Wolf. Trevor is the owner and pharmacist at Shakamak Pharmacy, and Wendy is working there as well. And Wendy has very many hats there, but she's also in charge of our enrollment center and helping people. So if you are in the Southwest Indiana area, by the way, Shakamak Pharmacy is not located in Shakamak, Indiana. It's located in Jasonville, Indiana, and that's in Greene County. So anybody in the area, or you can always call and Wendy will help you no matter where you live. So Wendy and Trevor, thanks so much for joining us today. And tell us a little bit, first of all, about yourselves, the pharmacy, how it came to be a SHIP partner as an enrollment center, and also a certified SHIP site.
Well, thank you, Susie. I'm Wendy Bailey. I've been a SHIP counselor this is my 5th year. Kind of just happened, but it's been a great blessing to my life. In that process, a lot of things have changed in the last 4 months, and I started making career changes. And Trevor and I kind of worked together the whole 5 years, helping his customers when they come in. He was doing the Part D, kind of looking at their meds, looking at the plan, seeing what's best. And then things would happen with like Medicare Savings, they may qualify, or extra help. So he was sending referrals to me. And when I made the big career change, it just kind of made sense to start an enrollment center here with Trevor and his gang. It's because I'm already helping them, with quite a few of their patients. So I went to him and said, I want to do this. How do you feel about it? And he jumped at it. So then it came to happen when we became a certified SHIP site, which is exciting. But I do a lot of going over new to Medicare's. If they qualify for Medicare Savings, looking to see if they qualify for the state assistance with premiums, copays, out-of-pockets, extra help with their Part D, which is a lot of what you see on a pharmacy side. Seeing whether they get that extra free plan or if their copays can be dropped based on income and any kind of resources they may have. So that's a little bit of what Wendy does. So I will give it to Trevor, who is the owner and pharmacist, and let you explain to him what the pharmacy provides.
Well, like Wendy said, my name's Trevor Wolf, and I own Shakamak Pharmacy in Jasonville. Wendy and I have a pretty good working relationship. 5 years, we've badgered each other, and we ask each other questions. Whenever she doesn't know the answer to something, she'll call me, and vice versa. So it just seemed like a natural fit for us to come together and work on this project together. There's a lot of different moving parts on Medicare, especially the extra help and things along those lines. I have a rough idea, but Wendy's an expert. It just makes sense for me to lean on her and her expertise to get the best for the people in this area. So it just seems like the best part about Wendy is she's always willing to help people. So my customers love her. Every time they see her, like, oh, I want to talk to Wendy. I'm like, okay, yeah, here's her phone number. We'll get everything set up, and it's a great fit, really.
Yes, and I work with enrollment centers all over the state of Indiana, and you are our first pharmacist relationship, and we are just so pleased. And like you said, it really does make a perfect fit to help people with their prescription drug plans during open enrollment. I know Wendy set up shop right there in your pharmacy. You carved out some space for her, and she was, as a SHIP counselor, she was able to help so many people look at Part D plans. And it's always good for those of us who are not pharmacists to have a pharmacist friend whom we can ask questions about drugs or changing medications or things like that. So we appreciate your partnership just so much, Trevor, and your willingness to be flexible and have Wendy there to be a certified SHIP counselor and help people with all things Medicare, and the enrollment center part of it where she's helping folks with applications for assistance. So Wendy, can you tell us a little bit about the programs that help people that you do applications for?
Yeah, the applications that I help the Medicare recipients with would be, one is the Medicare Savings Program, which is with the Indiana Medicaid program. It's not the same as, Hoosier Healthwise or traditional Medicaid. It's just there for Medicare recipients to get help with their Part B premium, which is that $170.10 they see taken out of their Social Security payment every month, and to see whether they qualify in a 3-tier system. Some can get additional assistance with their co-pays, if they have any, their deductibles, Part A or Part B, as well as having that premium paid. And generally, when you qualify for those categories of the 3, then you can also get extra help with your drug plan, which would mean you could get a free drug plan or one at low cost, and then your co-pays cut anywhere from, I think it's $385 to $985, somewhere in there per month, depending on the medications you take. So I do a lot of those, trying to screen and see what they qualify for. Sometimes they don't qualify for any. But then I also look as well, if they need additional resources, homes, food, clothing, things like that, because that's, kind of all ties together.
And you wear some additional hats too in your professional life that you can really go one step further, which enhances your SHIP counseling services. So tell us about what else you do, what else you're able to help folks with.
Okay. Well, I'm also an Indiana resident navigator for Medicaid and the Marketplace, a certified application counselor for the Marketplace, as well as a certified Indiana community health worker. And I specialized in chronic care paraprofessional. Sorry about that, it's a mouthful. And as a community health worker, my job is to mold the community and the community members together, help those community members find the resources that are available, such as food assistance, if they need housing assistance, if they need medication assistance. I've been helping a lot of people look at those applications as well, see if they qualify for those resources. And as the chronic care piece of my community health worker, I can help educate people with, chronic illnesses, diabetes, hypertension, asthma, mental health, helping them find mental health providers. That is a part where I work with the provider and their staff to make sure the care plan that they want in place for that patient is the best for them. But it all ties into the interns as well, because then we have to look at what they qualify for, if they, could have additional resources to help them. So we work on all that together as well. So that's a new piece that I just started. I got that about a year ago, and it's been a great gift to be able to do that and work back here in Greene County. But I see people from everywhere. I mean, they come from all places. I'm not here to work as just for a facility. I'm here for the community.
Right. And Trevor, it seems like your pharmacy, Shakamak Pharmacy, is so much more than a pharmacy. And I think a lot of that is due to you being a hometown boy and your staff, most of them being hometown gals, and Wendy living in, growing up in a nearby community as well. So people know you both and people trust you. And I think that goes a long way when you're helping people.
Absolutely. It's something to know the people by name, see them on the street, when you see them at another store, they'll stop and talk to you, they'll ask questions. It's great to have people that know you on a first name basis rather than just, oh, that's the pharmacist back behind there, we never speak to him. That's not the way I operate. That's not the way our team operates here. It's someone is going to know you. And I joke, but I'm serious. The old TV show Cheers, whenever Norm walked in, everyone said, Norm. That's the same thing here. Someone knows you. Someone's going to greet you and talk to you as soon as you walk in the door. And if you start cracking jokes with us, that's even better.
And it's a beautiful pharmacy too.
Thank you.
I visited there a couple of times. So Wendy, you're from somewhere near Jasonville too. So I'm sure you see a lot of friends and neighbors that come to the pharmacy that come for you, especially because they know you personally.
I do. I'm from Linton, born and raised, never left. But I love where I live and I love where I work. So, and the good thing about Jacoma is I did, before I came here, I did a lot of referring patients here because of the services they provide. They have our little fancy pill packs, which are handy for people, especially if you get confused. You know, sometimes those people need to know certain times of days what to take and what to, when to take it. And that's a helpful thing. We have home delivery in, Greene, Clay, and Sullivan County on Wednesdays. So that's helpful for those who cannot get out or don't want to get out. That's even better. And then they also do, a lot of the vaccines. Our pharmacists, Trevor and Dawn, we do have guys that work here, Susie, not just the ladies. They can do the COVID-19, which we usually carry the Pfizer or the Moderna. And then the flu vaccine, the pneumonia shot, your shingles vaccines, your hepatitis vaccine. Those are all things that Medicare will cover, for their patients with their plans at certain points, that you can come in and get those without having to go to the doctor and make an appointment and it possibly not get paid for through the physician office. And then they also have MedSync, which is nice, where you can, I'll let you handle that one because I'm not 100% on MedSync.
Okay, so MedSync is very simple. It's complicated, but it's not. It's the idea of patients don't have to come to the pharmacy 4, 5, 6, 7 times a month. The idea is we talk to the patient and they say, I want to get all my stuff at one time. Okay, fine. So what we do is we take a look at what they have at home in terms of medication supplies, and then we fill everything accordingly. That way, the next fill after that, everything comes at the same day or within a couple of days of each other. Then they can come in 3 or 4 days later, pick everything up. It makes it very simple for us to keep track of that patient's profile. It makes it simple for the doctor's offices because at that point, if they're out of refills on something, we send the entire refill request for the entire list of medications to the doctor. That way they can go, oh, hang on a second, I don't remember she was on that. Or maybe maybe we need to change that to something else. So that gives them the opportunity to review the entire profile at one time, rather than just, onesies come into the doctor's office and they'll say, yeah, we'll go ahead and do it. Again, it's one of those things to help the patient take their medication more effectively. And it also helps the doctors and us to be able to review for any kind of interactions or concerns based on their previous lab works.
Right. And that's so important with any age person, but especially with older adults, where things can go awry very quickly and mimic other health issues. So it's always good to have somebody that knows their drugs, looking out for those interactions. So that sounds like a great service.
Sorry, Susie, I didn't mean to cut you off. Another thing that they do that's kind of neat, that's hard to find, is compounding medications, where the doctors need certain things that you can't prescribe. And I know those are becoming kind of a hard place to go, with them only being, the hometown pharmacy.
Independent pharmacies are the only ones that do that. The chains don't do that. And it's one of those things that's really enjoyable. And a lot of times the pre-processed stuff from big manufacturers just doesn't work for everybody. The doctor will say, okay, we need to do a combination of this or that, or maybe a little bit more concentrated than what the manufacturers make, things along those lines. So we can make those suppositories, tablets, capsules. I've even been trained to make suckers and things along those lines for kids that don't want to take their antibiotics, via liquid. I can make them into suckers or things along those lines. So it's nice to be able to do that. Plus, I have pharmacy students from Purdue and Butler that both come to my pharmacy for their rotations. So I get to teach them a little bit about that as well.
Yeah, that's amazing. I do know here in Indianapolis, it is a struggle to find a compounding pharmacy that can, fill the medication you need. the flexibility how you need it. So that sounds cool. I'm all for, a lollipop instead of a pill.
We all.
So share with us just a little bit about how you came to be an enrollment center. And then Wendy, just shoot out some numbers so folks who are listening can think maybe they might qualify for some programs.
So for the Medicare savings, it runs anywhere from $1,720 a month up to, the new numbers just came out last week. I think it's about $1,900 for qualified individuals. And maybe I'm wrong. I'm going to go to Melanie on this one.
I've got a cheat sheet right in front of me here. I'll help you out.
There you go.
Yes. So there's 3 different levels for the Medicare Savings Programs. And that first number that you said, Wendy, was right on point, the 1720. So that's an income limitation for a single individual looking to apply for a Medicare Savings Program. But there are 3 levels. So the top level, a single individual's income can be up to, I got to look at my cheat sheet, $2,116 a month. So there's income limits for couples and singles, and even more than that as the situation presents itself. But that's why we have trained professionals like Wendy that can help you look at those programs and help you with that application process. Now I'm going to turn it back to you, Wendy.
And to become an enrollment center, I had to reach out to Susie and see if that was something that could even be a possibility, being a pharmacy. Like you said, Shakamak is the first pharmacy to partner with SHIP to ever be a site or an enrollment center. So that was something I wasn't aware of. I've always worked for facilities, and that's kind of a no-brainer on those. And that's when Susie loved the idea, I think. It seemed that way. I always think outside the box. And then I went to Trevor and told him what I was thinking, because I was already doing so much seeing his patients or customers. And he was like, just do it, So we just did it. And it's been really great. It's been a slow process because, we're trying to work through all those bumps of getting it set up, getting it going. But in that process, and I've only been in here since October, been in-house since October. So it's been about 4 months, and that's you have to have a growing period for everything. Now how Trevor feels about that, that's up to Trevor.
Oh, it's fine, because now the people don't have to drive to a different area to speak to Wendy. They just know Wendy's going to be here. So we'll get a schedule made out and they can come in, get everything taken care of. My customers love her. That's flat out. They know her as, I affectionately call her my little bulldog, because whenever there's any issues.
He said that for years.
Because I know that she's going to go in there and do the best for every person that walks in and sits down with her, because I've had many issues where I couldn't fix it. I didn't know how to fix it, but I was like, okay, I know someone that can. I send it to Wendy. Wendy gets everything taken care of. So to have someone like that in here every week to take care of this area is fantastic.
Yeah, it just seems like a win-win for win-win-win. Community, the 2 of you, the pharmacy, Wendy's community health role. It's just really a perfect partnership. And I know Megan and Melanie and all of their other coworkers at SHIP are excited to see how this rolls out. And hopefully we can find other very community-minded pharmacies and pharmacists like you, Trevor, and do some replication around the state. So we appreciate you and all the great things that both of you do.
Well, we appreciate all of you.
Do you call them Wendy Wednesdays when she comes to?
No.
I like that. I think we need to do some marketing around Wendy Wednesdays.
Wendy Wednesdays, and the little mascot could be a bulldog, maybe not an Indian or a minor.
It can't be an Indian. Yeah, I'm a minor at heart.
Well, we do have a chatted in question, guys. So Megan, feel free to chime in as well. So Sean, one of our coworkers, shout out to Sean. She's one of our biggest fans on here. she said, can you tell us what the difference between an enrollment center and a SHIP site is? And I think that's just kind of something that, jump in, guys, as you want to answer that question.
Megan, why don't you take that one?
Okay, I can. So they work very closely together. A SHIP site is going to help you with your Medicare needs as far as enrolling or changing your Part D drug plans or your Advantage plans, comparing to see if you're on the best plan for you. And an enrollment center is going to really be looking at those assistance programs like Wendy does, looking at the Medicare Savings Program and the extra help to assess you for those services.
Absolutely. My favorite thing about when we have the enrollment center and the SHIP site is that they are trained in all parts of Medicare. So if someone comes in and you need some assistance with affording your Medicare costs, not only can Wendy help you apply for that, or any enrollment center can help you apply for that, but then when it's a SHIP site and there's a SHIP counselor there, that SHIP counselor can help you navigate your options for your Medicare plans and help you with enrollment if needed, and kind of explain how everything works together. So I kind of do, I don't know about you guys, but I kind of do a happy dance when we get somebody that signs up to be a SHIP site and an enrollment center, because it's the perfect combination to really serve people in all parts of their Medicare journey. So we really appreciate you, Wendy and Trevor, and for everything that you guys do. So thank you.
And remember, folks, Trevor and Wendy are in Southwest Indiana, but we do have enrollment centers and SHIP counseling sites all over the state. And so to find one in your city or town, just call our toll-free number and we'll post that in our chat, and we'll be able to tell you where you can go that's close to your community.
Absolutely. So great transition, Susan. I've got our contact information popped up here on the screen so that you can find a local SHIP counselor or enrollment center or SHIP site, or all three, at a location near you. We're online, we have a phone number, and if you're watching this presentation, then you probably follow us on Facebook. But we're also on LinkedIn, YouTube, and Twitter. And these live presentations, you may be thinking, oh, I know someone that should hear this, or someone that would be interested in this. All of our live presentations are saved to our Facebook page for later viewing, and they are added to our YouTube channel as well. So Wendy and Trevor, you guys are now Facebook and YouTube stars. You're welcome.
Thank you. I lived for that,
TikTok is next, Wendy. TikTok is next.
Oh, we'll totally hit the TikTok. That's like my hidden passion.
All right. Well, I am going to turn it over to Megan here.
Thank you, Melanie. So this is our calendar for our upcoming March Facebook Lives. We have some great presentations scheduled for this month. On Monday, the 14th at 10 o'clock Eastern, we are going to have a special guest, Nancy Moore, from Senior Medicare Patrol. We are going to be talking about women in healthcare. And Nancy has been in healthcare for many years. She worked with the area agencies on aging. And so she's going to be talking about her story and her professional development. So that's going to be a very exciting presentation this coming Monday. And then we have one of our special Facebook Live presentations in Spanish, hosted by HealthLink SHIP counselors. And they are going to be talking to us about preventative care. And then we are also going to be talking about those on disability and Medicare, what you need to know about your coverage and your eligibility. So wonderful, great topics coming up this month in March. So stay tuned in. And again, a great thank you to Trevor and for Wendy coming on today, talking to us about Shakamak Pharmacy. It's a great partnership. We're excited to have you to see where that goes with other pharmacies, like Susan said, throughout the state. So thank you, everyone, for joining in today, and we will see you on Monday.